In this video, we inform you about early signs of liver problems that can help prevent serious consequences. The liver is the largest internal organ of the human body and fulfills many vital functions. It plays a key role in the lymphatic system, controls blood clotting, filters and ensures a stable blood composition. The liver also processes amino acids from the blood and produces substances necessary for the body such as proteins, glucose, fructose, glycerol, and fatty acids. It is also responsible for converting carbohydrates into glycogen. This is why liver problems affect the health of the entire body. One of the characteristic features of the liver is the lack of pain receptors, which is why pathologies of this organ often occur without a pronounced pain syndrome. Pain sensations only occur when the liver is significantly enlarged. However, it is important to take measures to prevent this condition. The liver is a regenerative organ that is able to repair its tissue after damage. If liver disease is detected early, a restricted diet is sometimes enough to cure it. However, in advanced cases, treatment requires radical measures and more serious medical interventions such as surgery or a liver transplant may be necessary. It is therefore important to monitor your health and watch out for signals to detect any liver problems at an early stage. Let's talk about what can be considered alarming symptoms: skin, itching, and flaking. The liver produces bile, which helps with digestion. Normally, bile passes from the liver through special ducts into the gallbladder. However, if the liver is not functioning properly, bile can accumulate or stop flowing altogether, leading to stagnation of bile. This can lead to itching and scaling of the skin. Such problems often indicate that the liver is overloaded or that a lot of bile acids have accumulated. Itching usually begins on the palms of the hands, soles of the feet, in the creases between the fingers of the hands and feet, and in places where the skin rubs against clothing. The itching can intensify in the evening and after a hot shower. Skin changes. Other typical skin symptoms are punctiform, hemorrhagic rashes, multiple bruises, and cholesterol deposits in the form of yellow plaques on the wrists, elbows, feet, and eyelids. In long-term liver disease, characteristic changes on the palms, palmar erythema, are observed. There may be symmetrical reddening of the skin in the area where the thumb and little finger are raised. If you press on the skin, it fades and then returns to its original color. Cracks on the heels. The liver constantly produces bile, which helps the body to absorb fatty acids and vitamins E, C, A, and B3. These vitamins are important for maintaining healthy skin. When liver function is impaired, the production of bile can decrease, leading to insufficient absorption of important substances in the body. As a result, the skin can become dry. To prevent possible complications, it is necessary to change the diet in time and adhere to an abundant drinking regime. The diet should be rich in greens, vegetables, fruits, berries, and whole grains. Edema. Edema can be a sign of liver disease, which in turn can disrupt the function of the kidneys and blood vessels. A dysfunction of these systems leads to fluid and salt accumulation in the subcutaneous tissue, which manifests itself as peripheral edema, especially in the legs. Hair loss. Increased hair loss is often observed in liver disease. The liver plays a key role in metabolizing nutrients that enter the body. If liver function is impaired, it cannot provide the body with the necessary building blocks for tissue regeneration, which leads to slower wound healing and increased hair loss. Increased sweating. Increased sweating may be related to the liver working harder when there is a high concentration of toxins in the organ's cells. This leads to an increase in body temperature and the symptoms of hyperhidrosis, excessive sweating. Constant feeling of fatigue. One of the most common and earliest signs of liver problems is increased fatigue and reduced performance. This is because inflammatory substances can form in the liver cells, the hepatocytes, and in liver diseases. These substances can impair the transmission of nerve signals in the brain, leading to fatigue and a poorer mood. Change in urine and stool color. Bilirubin is a yellow pigment that is an important part of bile. It is not only found in the blood but also present in urine and stool. When bilirubin enters the intestine with bile, bacteria in the intestine change its color to brown. It is exactly what makes stool brown. In urine, bilirubin is converted into another substance that makes urine light yellow. If a person has liver problems, it can affect how the liver processes bilirubin. If bilirubin is not processed correctly, it can leave the body with urine, making it dark. Moreover, the stool can become discolored if bile does not enter the intestine properly. Weight gain. The liver plays an important role in the processing of fats and carbohydrates in our body. If we don't exercise enough and eat too many carbohydrates and high-calorie foods, the liver can be overwhelmed with processing all these substances. As a result, excess fat can accumulate directly in the liver, known as fatty liver disease, and in adipose tissue, particularly in the abdomen and thighs. The accumulated fat leads to weight gain over time. Pain or heaviness in the right hypochondrium. The liver is covered with a capsule. This capsule reacts very sensitively to changes in the size of the liver. If the liver becomes inflamed due to alcohol or excess fats, it enlarges. This causes the liver capsule to expand, which can lead to pain, a feeling of heaviness and discomfort in the liver area. Rapid bruising. One of the main functions of the liver is to produce proteins that promote blood clotting. But if a person drinks alcohol frequently or has a viral infection of the liver, the organ can start to work less well and produce less of these important proteins. As a result, even a small bruise can spread and become a large one. Bleeding from the gums and nose for no apparent reason is also not uncommon. Jaundice. When the color of the eyes, skin, and mucous membranes turns yellow, this is called jaundice. This happens because there is too much bilirubin in the blood, a yellow substance that is produced when hemoglobin is broken down. Hemoglobin is a substance that transports oxygen in the red blood cells. Jaundice can indicate that the liver cells, known as hepatocytes, are not functioning properly. It can be due to alcohol abuse, viral liver infections such as hepatitis, or liver damage caused by medication. Abdominal enlargement. Most diffuse liver diseases are characterized by an increase in organ size. In portal hypertension, there is a simultaneous enlargement of the liver and spleen. In emaciated patients, the abdomen shows a pronounced asymmetry in which the enlarged liver is clearly visible. Digestive disorders can cause meteorism. Portal hypertension can lead to an accumulation of fluid in the abdominal cavity, ascites, the volume of which can reach several liters. With ascites, the abdomen looks flabby and the navel protrudes outwards. Spider veins. The appearance of spider veins, or telangiectasias, on the skin can be one of the first signs of liver disease. This symptom indicates the accumulation of estrogens in the body, which can have a negative effect on the vascular system. As a result, some skin vessels can expand up to 2 to 5 millimeters, making them more prominent and noticeable. Red spots on the body. Early symptoms of liver damage may appear as red or brown patches on the skin, sometimes spreading to the feet. The size of these skin elements can vary from small dots to small plaques. The appearance of such a rash is associated with the deterioration of the condition of the blood vessels and impaired circulation. The first signs of circulatory disorders are particularly common on the lower extremities. Dyspepsia. One of the first signs of liver disease can be dyspepsia. Patients may suffer from dyspeptic symptoms such as belching, nausea, vomiting, diarrhea, constipation, a feeling of heaviness after eating, and flatulence due to increased gas formation. Disturbances in the digestion and absorption of fats can lead to changes in the consistency and color of the stool. Liver diseases are often accompanied by changes in peristalsis and the color of the stool. It is important to know that the liver is particularly sensitive to regular alcohol consumption, as well as to the frequent consumption of roasted meat, fatty foods, and hot spices. These factors can lead to various liver diseases. It is particularly important to emphasize that regular periods of liver detoxification can play a key role in restoring its functions and maintaining its health. It is a simple and effective way to maintain your health. I hope the information was useful for you. Don't forget to like and subscribe to keep up to date with our latest content on natural health and well-being.